Good afternoon, dear colleagues. I am sincerely thankful for your invitation and I'm glad to attend as a speaker to Perfusion 2024 in Texas Heart Institute, the institute that has a great history and is first accredited school of perfusion technology in the United States. A year has passed since our last meeting. To be honest, this year was quite difficult. But we still continue to fight for our freedom and independence. We still continue to do our work. Today, I would like to discuss with you peculiarities of perfusionist work in Ukraine under military circumstances. So, first of all, I have no conflict of interest in this, my presentation. To begin with, I have to answer to the questions. Who is perfusionist in Ukraine? The profession of perfusionist is not approved by the Ministry of Healthcare or the Ministry of Education. The majority of the perfusionists in Ukraine have background in anesthesiology, 70%, 10% in nursing, 8% in physiology, 2% in cardiac surgery, and 10% in other medical-related background. In Ukraine, the first cardiac surgery cases with cardiopulmonary bypass were performed in 1982. In 2010 was the first successful ECMO case. For this time until 2016, the training perfusionist was provided just by local specialists and on the job. In 2016, the Association of Anesthesiologists, Perfusionists, and Intensive Care Specialists was founded. In 2018, Ukraine became a full member country of European Board of Cardiovascular Perfusion with certified program for perfusionists. In 2021, our association was supposed to undergo reaccreditation. However, this had to be delayed due to the war and the Russian attack on Ukraine. Now, perfusionist training includes a 9-month internship for doctor based at the National University of Healthcare for theory session and the practical part on the job in the leading cardiac center, Heart Institute, Ministry of Health of Ukraine. Perfusionist training has been offered mainly to anesthesiologists who have completed 3 years of internship in anesthesiology and intensive care. It's equivalent to residency in Europe. In 2022, before the war started in Ukraine, cardiopulmonary bypass was conducted by 57 perfusionists in 29 cardiac centers. However, the total need for perfusionists was bit over 100-120 perfusionists. Now, due to Russian invasion, we have about 40 perfusionists. That means that we have the highest lowering per one perfusionist in Europe. The Heart Institute, located in Ukraine capital, Kyiv, is a leading specialized scientific and clinical institution in adult and pediatric cardiology, interventional cardiology, invasive electrophysiology, heart and main vascular surgery, transplantation and medical rehabilitation. Since the war started, the number of cardiac surgeries with cardiopulmonary bypass in our hospital significantly decreased, especially during the first 6 months of invasion. However, we performed a record number of cardiac interventions with cardiopulmonary bypass for our hospital in 2023, on the second year of war. First of all, in our opinion, this situation is related with the shutting down a number of cardiac surgery hospitals close to the front line. On the other hand, a lot of Ukrainian refugees come back home in 2023 from European Union to Ukraine. Our perfusion team at Kyiv Heart Institute consists of 7 perfusionists. Among them, 6 perfusionists are anesthesiologists and just 1 surgeon. So our learning in 2023, when was our record year, was 306 cases per 1 perfusionist. To be honest, it's really difficult, especially under military circumstances. I would also like to mention that we provide care both for adult and pediatric population. About 10% of all cardiopulmonary bypass cases were during pediatric cardiac surgeries. All perfusionists provide both pediatric and adult surgery with cardiopulmonary bypass. Also, our hospital is the list of ECMO ELSA Center. It was the first in Ukraine certified by ELSA ECMO Center and was created on the basis of Department of Intensive Care Unit at Heart Institute, Ministry of Health of Ukraine. In general, our ECMO Center is able to simultaneously provide ECMO for 5 patients, both adults and children. Over the past 10 years, ECMO was used in 92 cases with survival rate about 50%. That just proves that we are on the right path. Moreover, we are proud of our heart transplants program. Despite the war, we increased the number of heart transplants from 70 before the war to 37 in the second war year. It is a great achievement for us and in general for Ukraine. Due to heart transplant program, we started using normal thermic regional perfusion to support the donor organs. In particular, we had 5 such cases for the last year. I would like to show you one of the recent cases treated at our institute, including the using ECMO after heart transplants. In fact, almost all extracorporeal technologies available at our institute were applied to this patient: ECMO, intra-aortic balloon contrapulsator, renal replacement therapy, cell saver, all in one photo. In 11th day on ECMO, the patient was successfully decannulated and happily enjoyed his first cup of coffee in 2 weeks. On July 9, 2023, a heart transplant was performed by a 6-year-old girl, Selenika. The donor was a 4-year-old boy who was diagnosed with brain death. It was the youngest patient that we perform heart transplants, and the first case in Ukraine where the donor of heart was child. There are all our children that we perform heart transplants last year. As I said previously, last year we were actively preparing for heart-lung transplantation. After a lot of training abroad in new countries, and also after performing experimental heart-lung transplantation on pig, we firstly performed it in human in Ukraine. So the first transplantation of the heart-lung complex in Ukraine was performed last year in October 24 in Lviv by our transplants team. Perhaps you will ask me why we didn't do it in our hospital. Unfortunately, due to military regulation, we can't use helicopter for delivery donor organs, and we don't have hard box. So, for this reason, we have to deliver recipients to the hospital where donors are. Here you can see the map of Ukraine. As the biggest European country, Ukraine has a really long distance from the capital of Ukraine, Kyiv, to the farthest place where performed the heart transplants. For example, the distance from Kyiv to the south of Ukraine, Odessa, is 500 kilometers. So, if we have donor in Odessa, we transfer recipient to donor and perform heart transplants in any hospital that sometimes even not equipped for cardiac surgeries. But we face troubles with our equipment regarding to long-distance transportation. For instance, in our case of heart transplants, we were not able to turn on system control panel on our hand-on machine. Likely this situation was occurred due to minus temperature inside bus, where high-low machines were stored, since previous case. We were about 500 kilometers from our institute and was not able to change hard-on machine because it's time. Therefore, our perfusionists had to provide heart transplants with cardiopulmonary bypass just on pumps, with direct vision monitoring the blood level. Another main problem that occurred was our heater-cooler unit that didn't properly work, so it led to increasing of cardiopulmonary bypass time. Due to frequency problem with our equipment and logistic challenges at the beginning of the year, we changed our approach for preservation of donor organs. We started using refrigerated chamber. So, After aortic cross-clamping and cardioplegia delivery, the donor heart is placed into a refrigerated chamber in our bus and is taken to our hospital. In total, we have such 5 cases with the longest ischemic time about 300 minutes. Now, the recipient is doing well and undergoing further rehabilitation. For instance, our last case of ECPR in the ICU. Patient in severe condition caused by chronic heart failure that required ablation due to arrhythmia. Cardiac arrest happened in the ward and patient was immediately transferred to the ICU. In general, CPR time was 45 minutes before ECMO connection. In 2 days, this patient was extubated and complained on that he can't walk with cannulas in his hips. He was successfully weaned from ECMO on 5th day. Because lack of supplies, in some cases, especially during ECPR in cath lab, when we expected relatively short ECMO run, we use our own main ECMO circuit with simple oxygenator from Harlan machine to save original ECMO set for longer runs. So, as civilian hospital, we have one more reason to use extracorporeal technology. It's combat injuries, especially penetrating heart injuries with fragment removal. In some cases, to remove fragments from the heart, we use cardiopulmonary bypass. But in some cases, primed Harlan machine was used to secure off-pump removal of fragments from the heart. In this case, the big bullet was removed from left ventricle with help of special magnet. So, what are the main peculiarities of perfusionist work during the war? First of all, risk of shelling during air alerts. We can't stop and go in CPB during attack and go to the basement. Working under blackout condition. On the second year of war, we already prepare for it and have different sources of energy at operation room. But we're not prepared for it at home, unfortunately. Lack of donor organs and the need of the use marginal donor organs. It increases cardiopulmonary bypass duration and frequency of ECMO using due to graft dysfunction. The closure of major medical center, higher loading per perfusionist, and more severe condition of patient at admission. Acute shortage of drugs and consumables. It's understandable. And the last one, provided care to injured military and civilians. I would like to end my talk with the old widely known Bible proverb about David and Goliath. In current situation, Ukraine is like David that fight against bigger and more powerful enemy. So the only one way to win for David is using weapon, sling. We also need such sling to protect our land against Russian invasion and permission to use it there. Unfortunately, it is the only one way to stop this war. Thank you for your attention and stand with Ukraine. Thank you so much.